far too long, conversations around perimenopause and menopause have been minimized, misunderstood, and simply avoided. Yet, this is a natural stage of life that impacts millions of Illinois women. In fact, 100% of women go through perimenopause and menopause. Women are working, caregiving, leading, and contributing every single day. Senate Bill 3325 takes a practical and thoughtful step towards improving care. Under current Illinois law, healthcare professionals are already required to complete a 1-hour implicit bias awareness training during license renewal period. That requirement has been in place since January 1st, 2023. What my bill does is simple. It allows a course covering perimenopause and menopause to count towards existing 1-hour training requirement. This is not a new mandate. It does not increase the continuing education hours. It does not create additional burdens for providers. Instead, it creates an incentive, an option for healthcare professionals to deepen their understanding of symptoms, challenges, and treatment options related to menopause while fulfilling a requirement they already have. So why does this matter? Because too many women report that their symptoms are dismissed or misattributed. Hot flashes, sleep disruptions, brain fog, mood changes, these are real medical experiences that deserve informed, evidence-based responses. When providers are equipped with better knowledge, patients receive better health care. Senate Bill 3325 is an initiative of the Lieutenant Governor's Office, and we worked closely with the Illinois Department of Financial and Professional Regulations, the Illinois State Medical Society, and the Illinois Academy of Family Physicians to ensure the language is thoughtful and workable. I am proud that the stakeholders have been supportive of this approach. Ultimately, this legislation is about respect. It is about modernizing how we think about women's health. And it is about ensuring that as we require implicit bias training, we also create a space for education to address real lived health experiences, particularly those that have historically been overlooked. I am so proud to stand with Senator Loughran Cappel and Senator Mary Etly Allen as we work to remove barriers to care and strengthen education for providers across Illinois.
Menopause is a natural biological process, but there isn't a lot of access to information on perimenopause and menopause treatments. Oftentimes, women don't know what's happening until they're going through menopause. About 6,000 women in the United States reach menopause every day, which is approximately 1.3 million women every year. As an advocate for women and someone who has gone through menopause myself and had its challenges, I filed Senate Bill 3688. The legislation would mandate education on menopause and perimenopause recognition and management at all medical schools here in Illinois. This would include practical nurses, registered professional nurses, and physician's assistants. Senate Bill 3688 builds on laws I passed last year, including requiring insurance companies to cover necessary hormonal or non-hormonal menopause treatments and requiring companies with over 25 employees to cover annual menopause health visits for women who are 45 years or older. This is a step forward from where we are, but there is still more work to be done. We not only need insurance companies to cover menopause treatments, but we also need our healthcare providers to be well educated on the topic. Thank you to Senator Johnson and to Lieutenant Governor Stratton for recognizing the importance of menopause awareness and for being great partners in this cause. Together, we can help Illinois improve how women live with menopause and perimenopause.
Thanks for watching this video. Please like and subscribe to keep up to date with news from the caucus. For more information on what the senator is working on, please follow them on social media using the links in the description below.